What if I told you that some of the medications sitting in your medicine cabinet right now, pills your doctor prescribed years ago, could be slowly harming you instead of helping? Last month, Martha, a vibrant 73-year-old grandmother from Ohio, ended up in the emergency room after a bad fall. The culprit? Not her age, not a medical condition, but a common medication she'd been taking for over a decade, a medication that's considered dangerous for people over 70. Martha's story isn't unique. Every single day, thousands of seniors are taking medications that medical experts now warn could be doing more harm than good. If you're over 70 or caring for someone who is, the next few minutes could literally save a life. Hello, friends. Today we're having an important conversation that every person over 70 needs to hear. I'm not here to scare you, but to empower you with information that your doctor might not have time to discuss during those quick 15-minute appointments. Here's something that might surprise you. As we age, our bodies process medications very differently than they did when we were younger. That pill that worked perfectly well for you at 55 might be completely wrong for you at 75. Your kidneys don't filter as efficiently. Your liver processes drugs more slowly. Even your body's water and fat composition changes, and all of this affects how medications work in your system. The medical community has known this for years, and there's actually a special list called the Beers Criteria, named after Dr. Mark Beers, not the beverage, that healthcare professionals use to identify medications that are potentially inappropriate for older adults. Yet millions of seniors continue taking these risky medications simply because no one told them to stop. Today I'm going to walk you through 5 common medications that people over 70 should seriously reconsider. For each one, I'll explain why it's problematic, what risks it carries, and most importantly, what alternatives you might discuss with your doctor. Let's start with one that's probably in most of your medicine cabinets right now: first-generation antihistamines. I'm talking about medications like Benadryl, that pink pill many of us have relied on for decades for allergies, itching, or even sleep. Now, I know what you're thinking. I've been taking Benadryl since I was 40. It's perfectly safe. And here's the thing, it was safer when you were 40. But after 70, everything changes. Here's why these older antihistamines are particularly dangerous for seniors. They have what doctors call anticholinergic effects. In simple terms, they block certain chemical signals in your brain and body. For older adults, this blocking action can cause some serious problems. First, these medications significantly increase your risk of falls. They make you drowsy, yes, but they also affect your balance and coordination in ways you might not even notice. Remember Martha from our opening? She was taking a common antihistamine for seasonal allergies. That medication made her just slightly more unsteady on her feet, barely noticeable to her, but enough to cause a fall that resulted in a broken hip. Second, and this is crucial, regular use of these antihistamines has been linked to an increased risk of dementia and cognitive decline. A major study from the University of Washington followed over 3,000 seniors for more than 7 years and found that those who regularly used these anticholinergic medications had a significantly higher risk of developing dementia. That's not a risk worth taking for a stuffy nose. These medications can also cause severe confusion and disorientation, difficulty urinating, especially in men with enlarged prostates, constipation, blurred vision, dry mouth that can affect eating and dental health, and increased heart rate. So what should you do instead? Talk to your doctor about second-generation antihistamines like Claritin, Zyrtec, or Allegra. These newer medications don't cross into your brain the same way, so they cause much less drowsiness and confusion. They're far safer for seniors. And if you've been using Benadryl to help you sleep, we need to talk about that separately, which brings me to our next category. Sleep problems are incredibly common after 70. I get it. You lie awake at 2 a.m. watching the ceiling knowing you need rest. So you reach for a sleep aid, or maybe your doctor prescribed something like Ambien, Lunesta, or benzodiazepines like Valium or Ativan years ago, and you're still taking them. Here's the hard truth. These medications are some of the most dangerous drugs for people over 70. Let's talk about benzodiazepines first. Drugs like Valium, Ativan, Xanax, and Klonopin. Yes, they'll help you sleep. Yes, they'll calm anxiety, but in people over 70, they're like playing Russian roulette with your health. These medications triple your risk of falls and hip fractures. Let me put that in perspective. A hip fracture after 70 isn't just painful, it's life-altering. Statistics show that within 1 year of a hip fracture, up to 30% of seniors will have died, and many who survive never regain their independence. That's not meant to frighten you, but to help you understand why this matters so much. Benzodiazepines also cause significant memory problems and confusion in older adults. Sometimes this confusion is mistaken for dementia or Alzheimer's disease, when really it's the medication causing the problem. I've heard from families who thought their loved one was losing it, only to see dramatic improvements after these medications were carefully stopped. Here's another issue. These drugs are incredibly addictive, and the longer you take them, the harder they are to stop. Your body becomes dependent on them. If you've been taking a benzodiazepine for months or years, please don't stop suddenly. That can be dangerous. You need to work with your doctor to taper off slowly and safely. What about PM medications, like Tylenol PM, Advil PM, or over-the-counter sleep aids like Unisom? Most of these contain the same problematic antihistamines we just discussed, with all the same risks: falls, confusion, and potential links to dementia. So what can you do for sleep? There are safer alternatives. Melatonin, used appropriately and in low doses, but discuss with your doctor first. Better sleep hygiene, consistent bedtime, cooler room, no screens before bed. Addressing underlying issues like sleep apnea, pain, or restless legs. Cognitive behavioral therapy for insomnia. Yes, it really works. And sometimes a low dose of certain antidepressants, like trazodone, is safer than traditional sleep medications. The key is talking to your doctor about sleep problems rather than just reaching for a pill that might cause more problems than it solves. Before we continue, let me ask you something. Are you currently taking any of the medications we've discussed so far? Have you noticed any unusual symptoms like increased confusion, balance problems, or memory issues? If you're over 60 or caring for an elderly loved one, this information could be life-saving. I encourage you to take notes, and please share this video with your family members. Your children and grandchildren need to know this information too, because they might be the ones helping manage your medications. And if this information is helpful so far, do me a favor. Hit that subscribe button and the notification bell. We release new content every week focused on helping seniors live healthier, safer, and more vibrant lives. Now, let's continue with the third medication category that's particularly risky after 70. Pain is something many of us deal with as we age. Arthritis, old injuries, general aches and stiffness. It's part of life. And for decades, many of us have reached for medications like ibuprofen, also known as Advil or Motrin, naproxen, which is Aleve, or prescription anti-inflammatory drugs. Here's what happens after 70. These medications, called NSAIDs, non-steroidal anti-inflammatory drugs, become significantly more dangerous. First, they're much harder on your kidneys. After 70, your kidney function naturally declines. You might not notice it, you feel fine, but your kidneys are working at maybe 60 to 70% of what they did at 40. NSAIDs put extra stress on already stressed kidneys, and regular use can actually cause kidney failure. I'm not exaggerating, this happens, and it happens more often than you might think. Second, NSAIDs significantly increase your risk of stomach bleeding and ulcers. As we age, the protective lining of our stomach becomes more vulnerable. You might take ibuprofen for weeks or months with no obvious problems, and then suddenly you're dealing with a bleeding ulcer, a medical emergency. Third, these medications increase your blood pressure and can interfere with blood pressure medications you might already be taking. They also increase your risk of heart attack and stroke, especially if you already have heart disease. Now, I'm not saying you can never take an ibuprofen. If you occasionally need one for a headache, that's typically fine. But if you're taking these medications daily or even several times a week, we need to look at safer alternatives. Let me also mention muscle relaxants, medications like Flexeril, Soma, and Scalaxin. These are heavily sedating and cause many of the same problems as the antihistamines and sleep medications we discussed. falls, confusion, and cognitive impairment. The Beers criteria specifically lists these as inappropriate for seniors. So, what are the alternatives for pain management? Acetaminophen or Tylenol is generally safer for most seniors, though you need to watch your dose. Never exceed 3,000 milligrams per day, and even less if you have liver problems. Topical pain relievers, creams, gels, and patches can provide relief without the systemic risks. Physical therapy and gentle exercise. Yes, movement can actually help pain. Heat and cold therapy. And in some cases, your doctor might consider newer, safer prescription options. The important thing is to have an honest conversation with your doctor about your pain and explore all options, not just pills. If you have type 2 diabetes, you're probably taking medication to control your blood sugar. Some of these medications, particularly the older ones, carry special risks for people over 70. The biggest culprits are drugs called sulfonylureas, medications like glyburide, which is also called diabeta, glipizide, known as glucotrol, and glimepiride, or Amaryl. These drugs work by forcing your pancreas to produce more insulin, which lowers blood sugar. Sounds good, right? Here's the problem. In people over 70, these medications cause dangerously low blood sugar, a condition called hypoglycemia, much more frequently than in younger people. And low blood sugar in seniors isn't just uncomfortable, it's genuinely dangerous. When your blood sugar drops too low, you might experience severe confusion and disorientation, dizziness and falls, heart rhythm problems, seizures, loss of consciousness, and in severe cases, it can even be fatal. I've heard stories of seniors who seem to be developing dementia, forgetting things, acting confused, having personality changes, when actually, they were experiencing frequent episodes of low blood sugar from their diabetes medication. Once the medication was changed, their mental clarity returned. Here's another concern. As we age, we often eat less, and our eating patterns become less predictable. Maybe you skip lunch one day, or you just don't feel hungry. These medications don't care whether you've eaten. They keep working, pushing your blood sugar down, which can lead to those dangerous low sugar episodes. Also, the longer you live with diabetes, the more likely you are to lose what's called hypoglycemia awareness, meaning you stop feeling the warning signs when your blood sugar is dropping. You might not feel shaky or sweaty like you used to, so your blood sugar can drop to dangerous levels without you realizing it. What should you do if you're taking these medications? First, don't stop them on your own. That could cause your blood sugar to spike dangerously high, but do talk to your doctor about alternatives. Newer diabetes medications like metformin, which rarely causes low blood sugar, DPP-4 inhibitors like Januvia, SGLT2 inhibitors like Jardiance, and GLP-1 agonists like Ozempic or Trulicity. These newer options are generally much safer for seniors because they don't typically cause dangerous low blood sugar episodes. Also, here's something important to know. Diabetes treatment goals should change as you age. When you were 50, your doctor might have wanted your A1C, that's your average blood sugar, below 7. But after 70, especially if you have other health conditions, slightly higher blood sugar targets might actually be safer. This is something to discuss with your doctor. Sometimes perfect blood sugar control causes more problems than it solves in older adults. Our final category addresses something many seniors don't like to talk about, but millions deal with: bladder control issues. If you're taking medication for an overactive bladder, drugs like Ditropan, Detrol, Enablex, or Vesicare, please pay close attention. These medications belong to that same anticholinergic category we discussed with antihistamines. They work by blocking certain nerve signals to calm an overactive bladder. The problem is, they don't just affect your bladder, they affect your entire body, including your brain. In people over 70, these medications commonly cause significant memory problems and confusion, increased risk of dementia with long-term use, severe dry mouth which can lead to dental problems and difficulty swallowing, constipation, sometimes severe blurred vision, dizziness and increased fall risk, and in men with enlarged prostates, difficulty urinating, the opposite of what you want. There's also something particularly frustrating about these medications. They often don't work very well. Many people take them faithfully and see only modest improvement, if any. Meanwhile, they're dealing with all these side effects and potential long-term risks to brain health. So what are the alternatives? First, behavioral approaches that really do work. Bladder training and scheduled toileting, pelvic floor exercises, Kegels work for men too. Reducing caffeine and alcohol, managing fluid intake timing by drinking earlier in the day, and weight loss if needed. Second, there's a newer medication called Marbatrique that works differently and doesn't have the same anticholinergic effects. It's not perfect, but it's generally safer for seniors. Third, some people benefit from devices or procedures like pelvic floor physical therapy with a specialized therapist, Botox injections into the bladder, yes, really, and nerve stimulation devices. The point is, there are options beyond medications that might be harming your brain. Don't just accept bladder problems as an inevitable part of aging that requires risky medications. There are better solutions. Now, before you panic and flush all your medications down the toilet, let me be crystal clear about something. I am not telling you to stop taking your medications without talking to your doctor. That would be dangerous and potentially life-threatening. What I am telling you is that you need to have an informed conversation with your healthcare provider. Here's how to approach this. First, make a list of every medication you take, including over-the-counter drugs, supplements, and vitamins. Bring the actual bottles to your appointment if possible. Second, for each medication, ask these questions. Is this still necessary for me? Is there a safer alternative for someone my age? What would happen if we tried reducing the dose? And are any of these medications on the Beers criteria list? Third, be honest about side effects. If you're experiencing confusion, dizziness, falls, memory problems, or anything else unusual, speak up. Your doctor can't help if they don't know. Fourth, ask specifically about non-medication alternatives. Could physical therapy help instead of a muscle relaxant? Could lifestyle changes improve your sleep instead of sleeping pills? Could behavioral strategies help your bladder instead of anticholinergic drugs? Remember, you are the most important member of your healthcare team. Your doctor is the expert on medicine, but you're the expert on your own body. Speak up, ask questions, advocate for yourself. If your doctor dismisses your concerns or won't discuss alternatives, it might be time to get a second opinion. You deserve a doctor who listens and who stays current with geriatric medicine best practices. Let me share a few more important points about medication safety after 70. First, something called the prescribing cascade. This is when you get a medication to treat a side effect caused by another medication, and before you know it, you're taking 10 pills when you could be taking 3. For example, you take a medication that causes dizziness, so your doctor prescribes something for dizziness, which causes nausea, so you get another medication for nausea. See how this spirals? Every time a new symptom appears, ask, could this be a side effect from one of my medications? Before adding yet another pill to the mix. Second, pharmacy reviews can be incredibly helpful. Many pharmacies offer medication reviews where a pharmacist sits down with you and goes through all your medications. Pharmacists often catch problems that doctors miss because they see the complete picture of what you're taking. This service is often free or covered by insurance. Third, beware of taking multiple medications from the same family. For instance, taking an antihistamine for allergies, a PM medication for sleep, and a bladder control pill, all three might be anticholinergic drugs, creating a triple whammy effect on your brain and body. Fourth, drug interactions become more dangerous as we age. A medication you've taken safely for years might suddenly become problematic when combined with a new prescription. Always make sure every doctor you see knows about every medication you take, including those prescribed by other doctors. Finally, remember that sometimes the best medication is no medication. I know that sounds radical in our pill-for-everything culture, but it's true. Sometimes watchful waiting, lifestyle changes, or addressing the root cause works better than adding another prescription. Let's recap what we've covered today, because this information is too important to forget. we've discussed 5 categories of medications that are particularly risky for people over 70. Number 1, first-generation antihistamines like Benadryl, linked to falls, confusion, and increased dementia risk. Safer alternatives include second-generation antihistamines like Claritin or Zyrtec. Number 2, sleep medications, especially benzodiazepines and PM products, dramatically increase fall risk, cause memory problems, and can be addictive. Better approaches include addressing underlying sleep issues, sleep hygiene, and sometimes safer alternatives like low-dose trazodone or melatonin. Number 3, certain pain medications including NSAIDs taken regularly and muscle relaxants, hard on kidneys, cause stomach bleeding, increase heart attack and stroke risk, and lead to falls and confusion. Alternatives include acetaminophen, topical treatments, physical therapy, and addressing pain at its source. Number 4, older diabetes medications, particularly sulfonylureas, cause dangerous low blood sugar episodes in seniors. Newer diabetes medications and age-appropriate blood sugar targets are safer options. Number 5, overactive bladder medications with anticholinergic effects harm memory and cognitive function, may increase dementia risk, and often don't work very well anyway. Better options include behavioral approaches, pelvic floor therapy, and newer medications like Myrbetriq. The common thread through all of these? As we age, our bodies change, and medications that once served us well can become dangerous. The good news is that for almost every one of these risky medications, there are safer alternatives. Here's what I want you to remember. Getting older doesn't mean you have to accept a medicine cabinet full of risky medications. It doesn't mean accepting confusion, falls, or declining quality of life as inevitable. You have the right to question your medications. You have the right to safer alternatives. You have the right to a healthcare team that listens and understands geriatric medicine. I've seen it happen time and time again. Seniors who were struggling with falls, confusion, or other problems dramatically improve when problematic medications are carefully stopped or changed. I've heard from people who felt like they got their life back after addressing medication issues. One woman wrote to me about her father who had been falling frequently and seemed to be developing dementia. The family was heartbroken, thinking they were losing him. Then, a new doctor reviewed his medications and found he was on 4 different anticholinergic drugs. After carefully adjusting his medications, he became more alert, stopped falling, and was able to enjoy his grandchildren again. The dementia they feared? It was largely medication-induced and reversible. You deserve that same chance at your best possible health. Take charge of your medication safety. Schedule that appointment with your doctor. Ask those tough questions. Don't accept "you're just getting older" as an answer when your medications might be the real problem. Your golden years should be just that, golden, not clouded by medications that harm more than they help. If this video opened your eyes to medication risks you didn't know about, please do 3 things for me. First, subscribe to this channel and click that notification bell. We're committed to bringing you reliable, research-based health information specifically for seniors every single week. Topics like managing chronic conditions, preventing falls, staying mentally sharp, and yes, medication safety, all explained in clear, understandable language. Second, share this video with your family members. Your adult children need to know this information, especially if they help manage your medications or care for you. Send it to your friends who might be taking these medications. This could genuinely change or save someone's life. Third, leave a comment below. Tell me, were you surprised by any of these medication risks? Are you currently taking any of these medications? What questions do you have for your doctor? I read every comment, and your experiences help other viewers realize they're not alone. And here's a bonus. If there's a specific medication or health topic you'd like me to cover in a future video, let me know in the comments. This channel exists to serve you and provide the information you need to live your healthiest life. Remember, friends, knowledge is power, especially when it comes to your health. The conversation you have with your doctor based on today's information could be the most important one you have all year. Take care of yourself, advocate for yourself, and know that you're not just a passive recipient of healthcare, you're an active participant in your own well-being. Until next time, stay healthy, stay informed, and keep living your best life. I'll see you in the next video.